Sandy, or Nancy, sorry. If Jean and Sandy speak and then they hand over directly, and then Sintai can hand over directly from there. And then Monica, if you could go ahead and just put up our the main presentation. If not, then I can present. Great. So just as a reminder for Nancy and Jean and Sintayu, if you just say next slide, Monica will be able to advance the slide.
Great. Is there any way you could make the Africa fit on the right after South, or is that too challenging to do now?
Monica, are you able to do that? Can you?
If not, don't worry about it. So, Catherine, I mean, will you sort of give us a prompt and say, okay, that's the last question, or should I just look at the clock and say, okay, last question and wrap it up? Or if there's another facilitator come in
a few minutes. I can give like a 5-minute warning. So the platform will shut us off. Okay, thanks, Monica. The platform shuts off 5 minutes after the official end time, so we can't go long. But I can give sort of a 10-minute warning and a 5-minute warning.
Okay, great, thanks. Do any of the other panelists have any questions? Anything you guys want to check in on?
I think I'm fine from my side, Nancy.
All right, thanks.
Hello? Hello?
Hello.
Yes, hello, we can hear you.
Hello. Can I proceed?
The session won't start for another 3 minutes. And
Okay.
the other panelists are going to go first, and then they will hand over to you.
Okay. Okay.
Hi, this is Catherine Brokenshire Scott. While we have a couple of minutes, I just wanted to say I'm here to take notes and to write down those 3 key takeaway points that will be presented tomorrow morning in the session.
Thank you so much for agreeing to be our note taker today, Catherine.
It's a pleasure.
I know you're invested in the subject as well, so.
Yes.
Hey, Catherine, thank you so much.
You're welcome. Nice to see your name again.
Yours also. I hope you can make it back to Kenya sometime.
Someday. Thank you.
Okay, good morning and good afternoon to everybody, depending on where you are. I want to introduce myself quickly and say my name is Nancy Kleinons. I'm an agreement officer based right now in Kenya. And we're excited to have this Subaward management panel. We're really hoping that our panelists can share some of their experiences with you all, and all the participants get a chance to ask questions. The topic of Subaward management is quite broad. So please, if you feel you have a question that might not be addressed in our presentations, don't hesitate to add it to the chat box. Before we get started, just a couple of reminders to please mute yourself. At any point during the presentations, please put your questions into the chat box, and please be sure to, on your chat box, you can click on the drop-down box that says all panelists and attendees so that people can see what questions are coming in. We will then answer the questions at the end of the presentation. Please also let us know if we're speaking too quickly or if the sound has gone out for any reason, okay? At this point, I'd like to welcome Vits Health Consortium, which is represented by Jean Durant and Sandy Naidu, and they're going to present to us first with a very nice overview, followed by representatives from Mary Joy in Ethiopia. So Jean and Sandy, I'm gonna hand it over to you now.
Perfect. Thank you, Nancy. Yeah, so as Nancy mentioned, my name is Jean Durant. I'm the CFO of Vits Health Consortium. We use the acronym Vits WHC, and I'm joined here by Sandy Naidu. So maybe if we can start with the presentation, the next slide. Thank you. Just to give a brief overview of what I'll be talking about, I'll just give a bit of a background from Vits Health Consortium's perspective in terms of what we do, what our operations are. We'll touch on the basics of sub-award management based on our experience in terms of managing sub-awards. Some key takeaways that we've actually, or it could actually be like a lessons learned from the last couple of years in terms of sub-award management. And then also some of the focus areas and the approach that we've developed to efficiently and effectively manage sub-awards. So that's what I'll be covering. So maybe if we can go to the next slide. Thank you. So from a WHC perspective, we're a wholly owned entity, a subsidiary from Vits University, which is one of the top rated universities within South Africa. Vits Health Consortium was established just over 20 years ago to act almost like as an extension of the Faculty of Health Sciences of Vits University in terms to manage third stream revenue on behalf of the university. So in essence, basically, we are providing an infrastructure or a framework to source and manage any type of donor or grants funds within the organization. Vits Health Consortium was incorporated within South Africa and is a separate legal entity within South Africa. In that, we've got our own legal framework. We also have our own governance framework. For instance, we have our own board with various subcommittees, which at the end of the day, we report directly into Vits University. Next slide. In terms of our operations, just to give an overview, I'm a finance person, so when I see numbers, it just makes more sense to me. But so at the end of the day, Vits Health Consortium, we're managing about $140 million worth of contracts per annum. It includes over 30 different types of funding sources, of which USAID is our biggest donor at this stage. And we've got various other donors as well from CDC, NIH, BMGF, Global Funds, etc. From a staff complement perspective, we have about 4,200 staff members, which is the project staff that actually manages all the technical side and the programmatic side of the contracts. Included in that 140 million worth of contracts that we're managing is about close to 800 contracts per annum that we are actually managing. On the way we structured, we actually have a back office support for providing the assistance from our HR, finance, payroll, contracts, legal perspective to all the technical staff, and that staff complement is about 288. And after 800 contracts that I mentioned that we're managing, we're currently managing about 70 subaward contracts. And it's quite key because I think if we think about 5 years ago, we were managing probably close to about 10 to 15, and we're now 5 years later sitting with 70. So clearly there is a trend of increasing subawards, which makes it very critical that you need to understand and manage the awards efficiently going forward. Next slide. In terms of the basics of subawards, I mean, I'm not going to spend too much time on this, but at the end of the day, we know there's a relationship between the prime awardee and a funder, which is the prime agreement. But then we also have to distinguish, and I think it's quite crucial that you distinguish between the subawardee and the subcontractor. The subawardee is a separate legal entity that is actually included as part of the proposal to your prime award, whereby this subawardee will perform is actually an extension of your prime deliverables and commitments that you need to comply with. The subawardee is actually more of a partnership. You actually need the subawardee to, in essence, to reach your goals and deliverables. And it's quite critical that you need to distinguish between them, because you do get your subcontractors, which are just basically the service providers. I mean, you can get a subcontractor that provides a service, for instance, an IT service or whatever. But at the end of the day, that's a service provider and it's not a subawardee. Why this is extremely important is at the approval stage. If it's a subawardee, you need to get pre-USAID approval, and I'll actually talk to that a bit more later. But why this is a bit of a risk as well, because we've seen from our experiences that entities sometimes list subcontractors in their budgets. However, when you actually look at the detail, they're actually more subawardee. So the impact there can be quite significant in the sense that at the end of the day, for instance, your subawardee had to go through a process of approval. And if you don't have that approval, you always run that risk that, for instance, the cost and the operations can be questioned by USAID at the end of the day. Next slide. A very basic timeline or just of a monitoring approach that is followed is the contracts always start with the proposal, where it goes into the monitoring and actually management, to the invoicing, and then to the closeout. Now, with this session, I'm just going to basically touch on the proposal side and the closeout side, because I think that's where usually there's maybe a bit of confusion, and based on our experiences, there were some issues that we had to resolve in prior years. Maybe we can go to the next slide. Thank you. So from a proposal stage, I mean, at the end of the day, this is the start of your relationship with your subawardee. The process that we follow is, for instance, the PI needs to identify the various sub-recipients that they would want to come on board on the subawardee. As I mentioned, we see it more as a collective partnership where they are extended arm of the prime in order to meet the deliverables and the targets. So this PI will then obtain various type of documents to ensure that and review the budgets, the statement of works, and all of that. However, what we're doing here at Vits Consortium as well is we actually set up a compliance department, if I may call it that. So the compliance department, at the end of the day, once the PI is comfortable with the various sub-recipients, we then start a process whereby we actually do a due diligence review on them. So that will include various aspects, from like checking prior audit reports, checking what the findings were and how it was resolved, reviewing the budgets, the statement of works, those type of things. We do a full-on risk assessment, especially with the internal audit controls. And then we also do a rating on that. I mean, at the end of the day, the compliance team will actually assess and say, well, we think this subaward has a high risk or medium risk or low risk. We also then have to ensure that, for instance, that they excluded from the excluded parties list as per the US federal laws and regulations. And the last point there is that it's quite critical and key that we need to get pre-USAID approval for that sub-recipient. I mean, it needs to be included in the budget so that the USAID says that they're fine with it, and because it can have quite significant consequences if you don't have that going forward. Next slide. The other, where there's sometimes a bit of confusion or maybe not the full process being followed that we've experienced, is on the closeout stage. So the closeout stage, there's, once the contract is actually ending, you sometimes get a view that both parties sometimes actually is of the view, well, we've dealt with all our obligations. So they actually just taken it quite easy from there on, and don't follow the full-on closeout process. So we've experienced it a couple of times. However, at the end of the day, the closeout is extremely important in terms of the US rules and regulations. Extremely important there is that we need to note that all obligations must be liquidated by no later than 3 months after the end of the contract. At the end of the day, closeout audits closeout procedures needs to be audited as well, and they need to ensure that, for instance, the reports are submitted to the prime, so the prime can at the end of the day say that we're comfortable with the audit, or if it's not comfortable, there needs to be a process in place of how you manage it going forward. Next slide. So I just want to spend a bit of time here. So as I mentioned, we've been managing about 70 subawards per annum now, and we're expecting it to increase. So what is our key takeaways or lessons that we've learned in terms of managing subawards? First of all, I think it's the importance of subawards. Gone are the days, I think, where the subawards are just a legal contract with an entity whereby they're just performing their role and they need to move on. It needs to be we felt it needs to be a more collaborative type of environment whereby you build like a partnership with them. And because at the end of the day, you need the sub-recipients to, at the end of the day, achieve the goals and deliverables for the prime. Expected future growth. As I mentioned, the trend that we're seeing is that there is quite an increase in number of subawards over the last couple of years, and we're expecting that trend actually to increase quite a bit. I remember, based on our experience a couple of years ago, there were a lot more prime awards given to entities with very limited subawards, but we see now that donor agencies are more likely to give limited number of prime awards, and then there needs to be more subawards. So, it actually just means that there needs to be more emphasis on subaward management going forward. Pre-award assessments, as I mentioned, these are it's critical. At the end of the day, it can cause a lot of issues, and it can be a big risk if organization didn't do a proper pre-award assessments. Then contract terms and conditions. So from contract terms and conditions, contracts are extremely important. For me, that's the starting point. That's where you draw a line and you say, with the sub, this is the relationship we're going to have. These are the contract terms and conditions. It actually helps that then, for instance, both parties are on the same page and both parties know exactly what is expected of one another. Responsibility and accountability. Even though you've got a sub-award, at the end of the day, you're the prime, which means that you as the prime need to take full responsibility when you report back to USAID. The fact that you have a sub-awardee agreement doesn't mean that, for instance, some of those obligations or commitment are actually, you're free from it. You need to still comply with that, and you need to make sure that the sub-recipient is also aware of that. That also brings me to the flow-down provisions, for instance. To make it quite easier just to manage the contracts going forward, we always include a clause that actually says that you need to comply with the flow-down provisions of USAID. That just assist the organization also going further down the line if there are any disputes or disagreements, that the clause did say that you need to comply with the USAID rules and regulations. Then continuous monitoring and management, which I'll maybe just discuss with the next slide. So with all of those lessons that we've learned, we've actually come up at Vits Consortium with focus areas and an approach. So we actually made a collective decision here at the company from the executives, whereby we had to decide on what are the fundamental blocks that is required to focus on in terms to ensure that we can manage sub-recipients effectively and efficiently going forward. So those are basically our focus areas. First of all is the understanding. Like I said, we made a mind shift change in terms of how we understand how sub-awards work and what they bring to the party, in the sense that they're more collaborative type of relationship. Knowledge and skill, because the sub-awards can be quite time-consuming in time and it takes a lot of effort. You need to ensure you upskill your staff with the relevant skills and knowledge so that they can manage the subawards from a proposal stage to a normal management stage and to the closeout stage. In terms of capacity as well, the capacity is extremely important. It doesn't help you've got all the knowledge and skills. However, you don't have enough staff actually to manage it going forward. For instance, here at Vits Consortium, we invested over the last couple of years in a small compliance department, which actually assists from the proposal stage to the monitoring and management stage to the closeout stage. But we also use that compliance department, not just to do reviews and all of that, but to also assist subs if they've got any questions or if they need any guidance, if they need maybe the compliance team to come through to do some training. So that's what our compliance department is actually set up for. And then the last one block there, but I think it's actually from a Vits perspective, one of the most critical blocks is actually the system. We saw that 5 years ago, you know, if we're going to see an increase in subs, we can't just carry on at that stage with those systems. So yeah, we had a normal ERP system and we had a normal payroll system. However, you need more. With IT and technology that's always evolving, you need to move with the future. So we then made a small investment over the course of the last 5 years, whereby we internally developed some systems within Vits Consortium that just assisted us like significantly in terms to manage these sub-awards. All these systems that we've actually developed is online, it's in the cloud, it's user-friendly. You can actually have access to on your phone, for instance. So it really did make a big difference. I just want to mention, for instance, as an example, some of our systems, we had a contracts management system whereby, you know, the sub-award contracts that are referred to where the terms and conditions need to be set up properly, those type of contracts we actually do online. So we send through a workflow process whereby it's reviewed by legal, it's reviewed by finance, and once we're comfortable, it actually just, we sign it. The other system that is quite extremely important, and we actually call it a disbursement system, but it's actually a sub-grants management system. It's extremely powerful, for instance, and it made our life so much easier in terms of you actually give the sub-awardee access to the system, whereby they can then log onto it on a monthly basis. They can upload, for instance, an extract from the ERP system, or even they can capture on that system against the budgets that's preloaded as per the contract, and they can upload all the supporting documents. So, and the system is actually catered to be very interactive. If there's any comments, they can put comments in. And once it comes to us and we're comfortable and we approve it, we can start the disbursement process. So these are basically the focus areas and the fundamental blocks that we decided that we need to put in place in terms of managing sub-awards going forward. Obviously, you know, it's always a changing environment. There's always changes. However, one of our key approaches is that we always need to be flexible and upskill ourselves. So, yeah, I think that's just from my side, our take in terms of sub-grant management. It's not a very big presentation. We just wanted to give quite a big overview. I'll be handing over now to Mary Joy now, to Santaya, to actually do his presentation. Thank you.
It appears that our colleague Sintayu from Ethiopia has dropped off the call. So Monica, if you could advance the slides, please, through the Mary Joy to the USAID component of our panel, then Nancy will be able to present. And if Sintayu is able to rejoin the call, then he will be able to present. So advance a few more slides, Monica. Yeah, it'll be all the way at slide 26. The next red slide. Apologies to everyone. I know. Oh, Sintayu, actually, I see that you were actually just able to join again. Are you able to? Oh, no. Yeah, Sintayu? We'll go ahead and, Nancy, why don't you go ahead and go through your slides and then we can hand back to Sintayu.
Okay, sounds good. Can you go to the next slide, please?
Hello? Hello?
Hi, Sintayu.
Hello, there is a strong power interruption here in Addis Ababa. I don't know. How can we do that?
I'm so sorry to
Anyhow,
hear that.
the power interruption, repeated power interruption.
Okay, I think that happens to all of us here in Kenya also. So let me quickly do a couple slides and then we'll go right back to your presentation, okay?
Okay. If in case this power out, may you please understand what the situation I am now.
Of course. Yes, and I'd
Okay.
say the same for me also because we also have internet and outs as well, as I know South Africa does as well.
Okay.
So the subaward topic is so very broad. I wasn't sure how best to structure it. That it would be most interesting to you all as participants. And I really hope you'll ask some questions in the chat box so that we can make sure we direct the subaward conversation to areas that are of most interest to you. One area that I think people often ask about is approvals. When do I need to seek approval? Well, how does this happen? So generally, in my experience as an agreement officer, there's two different scenarios. You might have a consortium that you pull together before you submit your prime application to USAID. And in that situation, you'd be gathering information from your subawardees, including a detailed budget, and you do whatever vetting you think is necessary to feel comfortable having them on your application. And you'd submit it to, along with your application to USAID to be considered as a prime. So at that point, if you were selected to be awarded your, let's say, cooperative agreement, the agreement officer could say, look, you know, I think you've given us enough information right now that we're going to approve your subawards. But the agreement officer could also say, I don't disapprove them, but I don't have enough information right now. So I'd like you to come back after you've been awarded your cooperative agreement with more detailed information for me to consider so I can approve it. And that most often happens when we see cooperative agreements that have a large sub-grant portfolio where maybe you haven't identified all of the entities you might work with during your 5-year program. In that situation, we would do it on a rolling basis. As you receive information, as you vet the entity, then you would come into the agreement officer by email to request approval. Can I get the next slide? Great. So just to reiterate, I think what Jean already said, there's some things that you don't need to get approval for. You know, you really don't need approval for contracts that are directly benefiting you as a prime. So that could be something like cleaning services, guard services, internet or IT support, your cell phones or fixed lines, you know, generator maintenance, things that are supporting you as a prime directly wouldn't be considered a subaward. You don't need my agreement officer approval. What would trigger the approval requirement is if you're going to work with an organization and that organization is going to help you reach the beneficiaries or objectives or results under your cooperative agreement. So maybe they bring an important technical area of expertise, or they're well known in a particular geographic area. And within that, they're going to have a certain amount of decision making. Their activities will be included in your work plan that you submit to USAID. When it's that type of relationship, then you're going to need to seek approval before you enter into the subaward relationship. Can I go to the next slide? So people often wonder, how long does this whole process take? And it can vary quite a bit. If you're working with a subawardee that you've worked with many times before, obviously it's going to go quite a bit faster than if it's an entity you've never worked with at all, right? So if you're going to vet a large entity for a complex, big subgrant activity, it could take you a couple weeks to really review their policies, go visit their offices. If it's a small, discrete, fixed amount award that they're doing, then perhaps you wouldn't need 2 weeks. You could do it in a few days. When you email USAID for approval, quite often it's going to take 2 weeks or more, depending on how complete your approval request is. And, excuse me, any questions the agreement officer might have for you. Keep in mind that when you send it, quite often I'm going to be speaking to your AOR to make sure that they're comfortable with it. I might speak to our lawyer, depending on what you want to do to make sure we're both comfortable with it. Your approval request could go through a couple different offices, and that's why it often takes quite a bit of time. So really, I'd encourage you to plan far in advance, usually at least a month before you actually want your activities to begin. Okay, next slide. Right. Please don't forget, your subs are required to have a DUNS number. And I recognize that's sometimes a painful process to go through, but it is a requirement. And quite often you might have to help your sub-awardee to do that or help them understand the steps they need to take. So you need to factor that into your time required to get to your sub-award. Okay, I think that might be the last slide. Yes. So Sintayu, are you online and available to do your presentation?
Yes.
Great.
Yes.
Okay, we'll
it seems good. Can you hear me? Oh, okay. Okay. Go. Can you hear me?
Yes, we can all hear you. I think we just need to load that presentation. I don't see it on the screen. So it would be the one from Mary Joy. Thank you very much. That's it. Okay, let's just give it a minute while we get up to the Mary Joy presentation.
Yes, nice. Good. Okay. I'm Suntayo Hailu from Mary Joy, Ethiopia Program Director, and the outline of my presentation is I will take a couple of minutes for organizational profile, and then award structure and Mary Joy sub-granting experience, achievements, challenges, next steps, question and answer. And I will be covering this within a short period of time, not more than 10 minutes. Thank you. Next slide. Mary Joy, Ethiopia, established in 1994 with the initiation and the pioneering of Sister Davida Zodi. She's the one who initiated this for the establishment of this organization. The organization has its own vision. You can just see from the slide. Mary Joy strives to be a sustainable organization that brings about lasting improvement in the lives of its target groups, and also the mission statement, and especially the vision statement holds a combination of two, the organizational sustainability. We would be assured for the last many years, the vision was more focused on community vision, but from last year onwards, having a good opportunity, especially from the legal point of view, the policy point of view of the country, we will be devoting some time and resources for the organizational sustainability to continue its services for the communities Ethiopian resident charity works to empower vulnerable and underserved community groups through integrated development programs. Next slide. Next. And we do have 4 program thematic areas. One is a livelihood enhancement, more focused on empowerment of economic empowerment of the community, and with more focused on women and youth. The other one is education, which deal with the access and the quality of education, and more of the preventive and the curative. The preventive part includes all thematic areas, or especially HIV, adolescent sexual reproductive health, and also reminiscent family planning, and so on and so forth. The institutional advocacy from the vision, the institutional capacity building and sustainability is taken as one of the major program of the areas. Next slide. We do have a cross-cutting issues. One is environmental protection, adolescent youth sexual reproductive health, HIVs, gender mainstreaming and inclusiveness. Child protection is the major cross-cutting issues which we consider while implementing and developing programs and implementing a program. Thank you. Next slide. The award structure. From October 1st, 2020, from October 1st, 2020, Mary Joy have experienced fixed amount award mechanisms, and the period of performance, as we can see from October 2019 to September 2020, funding type is fixed, not incremental. Grantees, we were working with 2 sub-grantees, progenies established in 1997 with the vision of equal opportunity for women, and Ethiopian Catholic Church Development Commission. It is church-affiliated organization for about 9 decades in the country. They were working development activities, but without registering as a NGO for a long period of time. But since 2015, they already registered as charity or non-governmental organization. Fund release mechanism is milestone-based, which means performance-based. After delivery of program summary reports of the months, no substantial involvement from inside as cooperative agreement. Next slide. The sub-grantees are selected. USAID made landscape assessment to local implementing partner, focusing on financial management capacity and accountability, program activity performance, working with local government, availability of qualified personnel or workforce, gave recommendation to sub-grant. They gave us recommended to include as a consortium member these 2 organizations. This is how we do. Yeah, next. The sub-granting experience. Of course, Mary Joy was having an experience of sub-granting some time ago, about 5 or 6, 7 years back, but unfortunately, due to the proclamation issued by then, the funding situation declined, and most of the time the sub-granting considered as an admin cost. Due to this, we stopped sub-granting mechanisms, both the unavailability of the environment, the political environment was not as such encouraging. Therefore, the legal issues already considered sub-grant issues as admin costs in 3017, and this is going to be included on that. The sub-grant activities, the organization, administration cost over time exceeds more than 30%. This is as it has the compliance issues. We stopped to sub-granting. After the last year, 2019, the government issued the new proclamation, which is a little bit good, and also allowed and provided many provided the resources, provided the money for comfortable environment for civil societies to implement or to work in a good condition. Therefore, relationship we have done after getting the award from USAID, we have made relationship building session with each partner leadership independently and have been carried out for, focused on introduction, discussion of the project objective and expected results, introduction and discussion on USG regulation and compliance issues. We have discussed the roles and responsibilities expected from each actors, lead and sub-recipients. And then made participatory budget and district SNU, subnational unit assignment based on each LIP experience and presence, and program activities identified to achieve the key strategies, objectives, and results, planning guideline and budget templates developed and amended. Next slide. This is organized planning session with technical team and standardized activity vis-a-vis each result areas, milestones, duration of training, key personnel, and unit of measurement. Discussed on the strategies and built consensus with all sub-grantees. Discussed and identified each partner's strengths and the document complementary role of each partners, cascaded the agreement to sub-grants what Mary Joy signed with USAID. Next. Organized monthly, and after having the agreement, we started the actual activity, organized monthly roundtable discussion in person until COVID-19 pandemic emerged at the presence of the SO that dealt with. Each partner was presenting the implementation or performance progress of the status of the month, program and finance, challenges they faced and solutions implemented, orientation and guidance on new incoming directions and strategies, discussion on supportive supervision findings, review periodic reports, and discuss on challenges. Delivery of weekly update status and subsequent week implementation plan have been experienced. Next. Delivery of summary performance report, financial and physical, and monthly supportive supervision and technical backups were implementing. After COVID-19, the lead organization maintained a virtual monthly review meeting, quarter virtual meetings, organized frequent virtual meetings on customizing our interventions in the context of COVID-19, new direction and guidance orientation communicated from OCHA. Achievements. Having done all the above activities, we have got the achievements. The partnership was so smooth and well-versed communication. The grant management properly handled and utilized as USCG rules and regulation without any compliance issues. The accomplishment rate of the project delivery reached at a level of over 90% more HIV stat and official indicators. The 395 have properly achieved. Comprehensive services are given in collaboration with the government and communities-based service providers. The budget allocated was utilized, efficiently utilized. The capacity of LIPSON program and financial management further enhanced, qualified staff. As a result of the project, organizations can be able to mobilize qualified staffs. Next. The challenges where the COVID-19 pandemic affected some of major activities, especially the primary prevention interventions, 9 to 14 girls and boy trainings, has already totally collapsed. Data quality issues, we are having such a problem. As the award was fixed amount award, no possibility of carryover, and hence there was a bit rush in the last month of the award. Most of the time, the fund was released after 20 days of the months. Introducing the solution, we took that, introduce and practice COVID-19 contextualized interventions are implemented, such as addressing the target groups through through physical through different mechanisms, especially on OVC case, the case workers with physical distancing, so over the phone, and others. And also frequent supportive supervision and implementation of routine data quality assessment has been undertaken, and corrective measures are taken frequently, especially to respond to the data quality issues. Next. Thank you very much.
Thank you so much. I appreciate that. It's really, it's wonderful to hear your organization's specific examples of what you've been through, some of the challenges you faced, and then how you got through those challenges. I have seen a few questions come up in the chat box, and I've also seen a few people commenting on sound quality. Obviously, that might vary if we're speaking to you from different countries. I hope the sound quality is a bit clearer now. Please let us know. So I think Ivan asked one of the first questions that I believe also is one that I was going to ask the panel as well. So let's start with that one. So the question I was going to ask, which is similar to Ivan's, is, and Jean, this could be for you. It's, so what are the factors you're going to consider when you're deciding on the number of subawardees you might have and what they might be doing? And then I think Ivan even broadened the question further to say, what are some of the tools you might use?
Thank you, Nancy. Yeah, so I think, you know, you need to look at, for instance, first of all, the activities of the prime. You know, if the size of the activities is quite significant, obviously we need to consider getting various sub-awards on board. But then you need to, and that's where I mentioned, you need to have a proper pre-award assessment program in place, whereby, you know, you get a hold of various sub-recipients that might be interested to join your program. However, you need to do a proper reassessment, proper due diligence. What are their experience? What are their expertise? How long have they been in existence? You know, checking pre-audit reports to see what the type of findings are. You know, you might be also that you've worked with other organizations that maybe worked with this organization, you know, just have an informal discussion also what their views are in terms of the, you know, the work that they perform. So that's what we would actually consider from tools that we would be using. Like I mentioned, based on our experience, we've got a compliance department that we've actually upskilled to manage this on our behalf. And obviously sometimes it happens that you need to reallocate maybe a bit more staff. But as long as you've got the right level of skill and with the relevant experience and they know what needs to be done, it's all about just coming up with an action plan in terms of what is required and making sure everybody is on the same page in terms of what will be done. I hope that answers the question.
Thanks, Jean. I think that was really helpful. I think there are a couple of people that have asked more specifically, what is this? It sounds like an electronic sub-grant management system that you all use. Is that something that you could comment on?
Sure, thanks. So the electronic system that I'm referring to is actually an internally developed system within Vits Consortium. We actually spent quite a bit of time a couple of years ago in terms of doing an assessment of what is the sub-recipient requirements in terms of, you know, from a financial perspective, a technical perspective, timelines, all of that. And because we in the industry, we decided that, you know what, we're going to spend some time, we're going to develop it ourselves. We're going to make it applicable to the donor rules and regulations. And that's where we came up with this disbursement system. And like I previously said, it's an online system that we've internally developed. We're actually using it with some of our other sub-recipients, whereby they will have full access. They can upload financial reports, technical reports. Everything is workflow in the cloud, and all supporting documents is also stored online. So it's an internally developed system. I saw in the comments as well, if we can share details with that. I mean, if somebody maybe wants to reach out to me, I'm happy to have a discussion also in a separate meeting with them. So, yeah.
Thanks, Jean. That's really helpful. It sounds like a great system, and I'm sure it's quite helpful to you all given the large number of subawards that you have. Sintayu, I've seen a couple questions come through about fixed amount awards. And then what someone was asking is what to do if somebody misses a milestone. I would like to comment, I think the question, let me read it out loud. It says that if payment is done after a month under a fixed award amount, what happens if you miss 1 or 2 milestones? Could you comment on that, Sintayu?
The fixed amount award is already have its milestone and would be expected to just ask the fixed amount after achieving more than 80% of the set targets, especially OBC serve and LVC HIVs that would be expected to report that one over 80%. Therefore, what we did, the agreement clearly indicated that in order to just ask those money, we will be expected to deliver all this 80% or so, more than 80% and more than 80% in a month of time. Therefore, what we did, our experiences are we have tried and we have mobilized all the resources, the workforces, and to understand the issues and undertaking monthly supportive supervision and can be able to manage to address those targets with the upper limit, the threshold, the upper limit of the milestone set. Unfortunately, we have not faced, we didn't test whether the USAID would release or not if we miss the first or the second month. We have been trying all our best to complete the issues within a month of time. This is the experience what we have had. Especially during the COVID time, we were not be able to achieve the milestones due to this about the first after 2 months or until we can contextualize all our activities, 2 months have been released about 80% of the total finances or the budget. This is the experience we have had. And I have seen from Mabra to Marcos, what does it mean when you use C95 was properly achieved? How many percent did you? The experience we have had that we would be expected that 95% of targets know their HIV status. This is what we planned. And also 95% of HIV positive targets linked to ART. This is what we planned, and 95% of HIV on ART have suppressed the virus loaded. This is what we have planned. That is the issues now. The last report, the last milestone report have shown that all the 95 we have already planned, almost more than 97%. Of course, the data is not just, I can't see it now, but all are over 95% was achieved, especially those with this indicator. Thank you.
Thanks, Sintayu, that's helpful. Just to provide a short agreement officer perspective on this, I would say that if you're a prime, you have a choice about what type of subaward you want to enter into, and it could be cost reimbursement or fixed amount award. And if you don't have certainty about being able to meet the milestones, and that happens sometimes, I see our awards modified many, many times, then you might want to consider a different mechanism. But if you were under a fixed amount award as a sub, and you are not meeting your milestones, please remember you're not implementing in a vacuum. You have an AOR and an AO and your prime. So I would encourage you usually, as if you were a sub awardee, the first thing you would do would be to go to your prime and say, something is not working here. It could be factors outside of your control. The prime would then hopefully communicate with USAID and say something is happening here. It might be environmental or, for example, COVID, as Sintayu mentioned, has really thrown so many things awry. I don't want to run out of time. So moving on, we've got a few more questions for Vits. Jean, somebody is asking, how do you address quality control of programs for sub-partners? Do you have a system like SIMS?
Thank you, Nancy. So it actually comes back to our disbursement system that we're using. As I also referred to, at the end of the day, all of those documents, if it's technical, whether it's financial, it's actually uploaded online. It's submitted to our grants and finance team. They actually review it and they make sure that they can tick that all the deliverables are met. We also get obviously the technical guys involved on this side. So they need to also commit and actually authorize that they're comfortable with the progress that are made. So yeah, I hope that answers the question.
Okay, we had one more question for you, Jean. It says, it's from Brad, and he would like to know if you have ever identified fraud on a sub, how did you identify it? Through fraud indicators or some other system?
So we have actually previously identified fraud in a previous instance, and it was with one of our subs, and we picked it up via the actual review of documents that are submitted. So on a monthly basis, if the sub-recipient or the sub-awardee wants a reimbursement, they would need to provide all the supporting documents. And that's when we realized, based on that something didn't look right. Our finance guys actually then referred it to our internal audit and compliance teams who performed an investigation. And at the end of the day, it was actually, we picked up that it was a fraud incident that happened at the sub-recipient. In those instances as well, obviously then, for instance, the sub-recipient needs to take responsibility for that, and they can't charge that cost to the relevant award.
Right, and just as a quick follow-up, I'm sure, Jean, as part of your overall monitoring, you're probably also going out to visit sites or trainings or other things that your sub has stated that they're doing and has asked reimbursement for. I'm sure that's also part of your normal monitoring and oversight, right?
Yes. So yeah, from our side, our compliance team will do site visits. They will just a very basic visit to make sure that everything seems in order. Also, if we do online reviews of documentation, we will from time to time also request to see the actual originals, because at the end of the day, we need to know that the originals are there. So we do quite a few bit of checks through our compliance teams to ensure that everything, but also at the end of the day, there needs to be open communication lines as well. So our compliance teams will then work through the grants teams with the various sub-recipients to inform them of a site visit, and just to make sure that everybody's on the same page. But also, just maybe to add on that, our compliance team are also there not to just be seen as, like a police officer. We also wanted to create an atmosphere that the subs can actually approach us and ask us for either guidance or some advice. And we're happy to, in the past, we've actually also provided some training sessions to the subs in terms of for instance, compliance and also fraud indicators. So it's, at the end of the day, like I said, we see this as a more collaborative partnership with the subs, and we always urge them that they need to be upfront and communicate with us if they need anything.
Yeah, I think you raised some excellent points about communications, and in my experience as an agreement officer, I think it's really rare that either a prime or a sub can start out with a plan and at the end of the activity find that they followed it exactly. There's always some type of correction here and there, and that's not necessarily because of poor performance. It could be things that on the ground realities that pop up and cause you to shift direction in one way or the other. So what you said about communication is just extremely important in managing that relationship. and making sure you all and your subs are responsive to whatever situations might arise. We only have about 5 more minutes left, and I want to ask you all to please complete the poll so we can receive some feedback on this session. And we probably have time for 1 or 2 more questions if anybody has other questions. So we have a question for Mary Joy. Did you use reporting and dashboards to support your program improvement?
Hello, hello.
Hi, Santayu, can you hear me?
Yeah. May you repeat it?
Sure. The question is, do you use reporting and dashboards to support your program improvement?
Yes.
It sounds like it's a question, yeah, about monitoring perhaps.
Yeah. Oh, as I informed you previously, we used a supportive supervision and monthly supportive supervision and weekly updating and also monitoring and evaluation every month. This is to just improve the program quality. This is how we used for the last 1 year. And also, we do have a monthly meeting with Subawardists and discuss on the issues and how the challenges they faced, how they worked, and so on and so forth. We use that one, and we do have the reporting mechanisms and templates, and also supportive supervision checklists. This is how we use it to the improvement of the program. Thank you.
Thank you, Santayu. I think we might have time for 1 more question. One question I wanted to pose to either Jean or Santayu is, have you experienced situations where you felt your organization needed to ramp up your personnel or resources to effectively monitor or provide capacity building to your sub-awardees, and how would you address that?
Thanks, Nancy. Maybe if I can quickly provide, just based on our experience. So we actually recently had quite an experience where we received a Prime Award and we actually included 8 sub-awards on that. Now, as you can imagine, there wasn't a lot of time. We actually had to scramble quite a bit to ensure that we've got the relevant processes in place, that we've got the relevant level of skills involved, all of those things. So what we then did from our side as well is, again, that pre-award assessments are quite critical and key. That's where we actually identify any the strengths and weaknesses from various sub-recipients. And also at the end of the day, it doesn't mean like a sub-recipient, they score badly on certain things that we don't go with them. We also try and actually build capacity within them by providing them with the relevant training, upskilling them, giving them guidance, and ensuring that they then are up to standard in terms of going back to US8 and get that approval in place.
Great, thank you. I think we're going to wrap up now. I think we only have a couple minutes left, and then I believe the webinar will automatically close. I want to just take a chance to thank Jean and Sandy and Santayu from Vits Health Consortium and Mary Joy, Ethiopia. Thank you so much for joining us. We enjoyed hearing about your experiences, and I hope all of you participants were able to learn from their experiences as well. So thank you very much for joining us, and please do try to complete the Zoom poll so that we can ensure any future sessions meet your needs. Thanks very much.
Thanks very much. Thank you very much. Thanks.
Thank you.
Thank you.